What's so special about mental health in Geel, Belgium? In Ontario, mental health services and support are predominantly provided by means of community agencies, hospitals, and health clinics. This means that individuals who are diagnosed with mental health conditions are removed from the community to receive treatment. This method subsequently reinforces the stigma behind mental health conditions by validating that these individuals must be removed from the community. This current system is posed in order to fix the individuals in hopes to return to the community.
It all began with Saint Dymphna around 500 AD. She was the daughter of an Irish king named Damon. Legend has it that he went mad after his extremely attractive wife passed away. The king was so distraught and delusional that he began thinking only his daughter could replace his late wife. In order to escape from the outrageous desire of her father, Dymphna, a devout Christian who had taken a vow of chastity at the age of 14, ran away from home and was led by a priest into the forest where she could hide in the chapel of St. Martin. However, the king discovered her whereabouts and presented her with a choice: either marry him or she would get beheaded. Dymphna chose the latter. Because she had chosen to die instead of denying her love for Christ, miracles started occurring at the location of her martyrdom, in which people suffering from mental illnesses were cured. In 1247, Dymphna was canonized as the patron saint of the mentally ill, and the chapel was built into a larger church, the Church of St. Dymphna. As news of the miracle spread, more people traveled there, and the town of Geel, Belgium developed into a sanctuary for those suffering from mental illness.
In the center of Geel is a medical facility called the OPZ that oversees the guest family foster system. To enter the family foster system, a guest must have a severe mental illness or cognitive disability, making living independently difficult. The guest is then assigned a foster family to live with. A guest can stay for decades with a family and help out around the house. The local government gives a stipend to the host family to cover meals. During the peak of the Geel model, there was 3,800 guests living with families. The program is not about curing a guest, but accepting people for who they are, work with the patient, and use the recovery model. The guests are accepted by medical professionals, their foster families, and the community as a whole. The foster family program has been in existence for so long that the stigma of mental health has been taken away from the equation. The label of mental illness has been removed, making everyone unique and different. A person having hallucination will be served at a cafe just like everyone else.
The nursing care in Geel is very different than what we see here in Canada. The system that Geel has in place is very community-based. A long-term foster care system, a physician meets with the clients once a month and a nurse every other week for checkups. The Geel model of treatment allows the patients to heal and recover through acceptance, understanding, and the gentle rhythm of life in their society. The relaxation and comfort they can feel allows them to recover without great personal intrusion from a nurse or physician. Plans have been made to set up neighborhood treatment centers where the mentally ill can partake in group therapy, schooling, and vocational training. The nurse's role in Geel's method of nursing places the nurse distant from the patients, giving them privacy. However, a therapeutic relationship is very important for when they do meet with the nurse. Having a therapeutic relationship will promote the healing through different symptoms or concerns.
When we consider whether the Geel model can come to Canada, we have to ask ourselves, do we want a whole Geel system where the entire community is working towards the idea of wellness, or do we simply want family boarding? If boarding is the case, then the Americans have already accomplished that in some places. With original ideas from Dr. John Gall, the state of Massachusetts has offered family-centered housing for those living with mental illness decades ago. Even though it was based off the Geel model, it was used primarily as a way to reduce the amount of patients in psychiatric hospitals. Scholars did notice the huge advantages that the program itself offered. The overall cost to treat patients was lower, and boarders had a much higher satisfaction rate than when they were at the hospital. One of the greatest concerns Canadians seem to have in regards to the system moving to Canada is the threat of violence. However, even in Geel, those with a history of violence are not allowed to participate in the program. If the program was to be brought to Canada, we would have to do much more education and social reforms for the dedicated community. One day, this will all be possible, and Geel mental health care will be integrated into our culture.